So we know that there's a lot more to it than genetics. If you look at all of the science that we have been accumulating over the last century, really, if you look at all of the genetic studies that have been done, when you look at all of that and put it together, it paints a very clear, unequivocal picture. And that, the simplest way to put it, is that mental disorders are actually metabolic disorders affecting the brain. We are currently ranked #1 in the United States for psychiatry. And I don't say that to brag, but I say it because we are starting research trials of the ketogenic diet for serious mental illness. Finally, we might have new treatment options for the millions of people who are not getting better with our current treatments.
On this episode of the podcast, we talk to Dr. Chris Palmer. Dr. Palmer is a Harvard psychiatrist, researcher, and author of Brain Energy, where he unites our existing knowledge about mental illnesses within one single framework, that mental disorders are metabolic disorders of the brain. We hope you enjoy it. All right, let's go. Dr. Chris Palmer, thank you for doing this and welcome.
Thank you for inviting me.
It's a pleasure to have you on. I thought we could start by creating some context or laying some context. Are we really today more depressed, and do we have more anxiety than in the past? Or could it be that this is more of a perception, that maybe in the past people already had these problems as much as we do today, but they just didn't have an outlet. They just went on with their lives and suffering in silence in a way. Whereas today we do have options for people that are suffering from this. So are we more depressed today than in the past, or is it a perception?
It's a really important question, and one that some experts debate about. I think some people do believe that maybe we're just recognizing depression, anxiety, and other mental illnesses more often because people are talking about it more. Celebrities are coming out, sharing their stories, and it's in the news more. But the reality is that the scientists who are studying these disorders and the prevalence of mental illness are pretty unequivocal that the rates are in fact going up. The rates of depression, just last year in the United States, reached an all-time ever recorded high, but they were even going up prior to the pandemic. So there's no doubt that the pandemic took a huge toll on people's mental health, but even before that, rates were going up. Rates of anxiety are up, especially in children and adolescents. Rates of ADHD are up. Rates of autism are up. They've quadrupled in the last 20 years in the United States. So it's curious that the rates of a wide range of mental disorders are all increasing at the same time.
Historically, it's been said, the story that we have always heard is that all these mental health issues are rooted in some sort of genetic predisposition, maybe in combination with some chemical imbalance in the brain. I've always heard that story, and I'm sure there is something of that. But your work in Brain Energy, in your book, points in another direction, right? So, by the way, very thorough, this book. I loved it. It is
And
dense.
available in Spanish.
I know I ordered it.
If I can get that.
I have ordered 2 copies for 2 very close
Awesome.
people that in my life.
Awesome.
They're on the way, the Spanish copies. So in that book, you point in another direction, right? So what is this direction?
So I want to start by saying, yes, mental illnesses do run in families. And so genetics and inheritance do play a role. But we have long known that genes themselves are not enough because people can inherit genes. You know, if it was purely genetic, people would have mental illness from infancy. They would have it right away and it would just last their whole life. And we know that that doesn't happen. And so even when people have a very strong family history of mental illness, some people can live the rest of their entire life without a mental illness. And other people can develop a mental illness and everybody in their family was fine and healthy and never had any mental illness. So we know that there's a lot more to it than genetics. And what I am arguing in brain energy is that if you look at all of the science that we have been accumulating over the last century, really, if you look at all of the genetic studies that have been done, where the scientists try to understand what exactly are these genes doing, when you look at all of the neuroimaging studies, the brain scans that we're doing on people, when you look at um, all of the, sometimes they take blood samples from people with mental illness and they look for abnormalities and they've found higher levels of inflammation and other kind of abnormalities in the blood of people. When you look at all of that and put it together, it paints a very clear, unequivocal picture. And that the simplest way to put it is that mental disorders are actually metabolic disorders affecting the brain.
If that is the case, what is causing this? Is it the way we live? Is it our lifestyle? Is it the food? Is it that we are stressed, underslept? We don't exercise? What is it? All of the above? What is it?
All of the above. It's all of the above.
Yeah.
And so absolutely genetics can play a role and family history can play a role, but so can your diet and sleep or a lack thereof, stress levels, trauma, childhood trauma in particular can play a huge role. And so a lot of people think, well, we already knew that. We already knew that childhood trauma plays a role. But guess what? So childhood trauma, if we just focus on that alone, that can increase your risk for every mental disorder listed in the Diagnostic and Statistical Manual. So if it happens at a really young age, it can actually cause neurodevelopmental disorders and contribute to things like ADHD or even autism. It can contribute to depression, anxiety, post-traumatic stress disorder, substance use disorders, personality disorders, but even things like bipolar disorder and schizophrenia. But guess what else childhood trauma puts you at increased risk for? It also puts you at risk for obesity and diabetes and cardiovascular disease, which we usually think of as metabolic disorders. And so we need to start integrating this science. We need to stop separating mental health and physical health, and we need to put it together because it does fit together.
And do those lifestyle interventions that we were just talking about have a positive effect for people that might have had childhood trauma? Like the fact of managing that via lifestyle interventions, would that somehow help?
Absolutely. So it's not that I want to throw away effective treatments. So trauma therapy can be highly effective for some people, and some people might really benefit from psychiatric medications for their trauma. But if we ignore the comprehensive picture, a lot of people unfortunately don't get better despite years or decades of trauma therapy. Other people try pill after pill after pill, and they still don't get better. And they want to get better. And so we need to think more comprehensively. And the reality is that, yes, sometimes, even if trauma was the root cause, sometimes helping people change their diets or exercise more or learn how to reduce their stress levels or prioritize sleep, sometimes helping people with those lifestyle interventions can make all of the difference in the world and can help people fully heal and recover.
So you mentioned psychiatric medication. Do they work for everybody, or is there a component of placebo effect for other people? So what's your take on this? Do they work in general?
So I think in general, psychiatric medications do work, but the caveat is only for some people. Um, so with depression, let's take one of the more common mental illnesses, depression. When people have clinical depression and they try an antidepressant, only about 30% of the people will actually no longer be depressed after trying that antidepressant. 70% will still meet criteria for clinical depression. Now, that doesn't mean that all of those 70% won't get any benefit. Probably about 70% of people will get some benefit, but their symptoms don't go all away. And in fact, they have enough symptoms and the symptoms are severe enough that 70% will still be clinically depressed. And
Yeah,
I would argue that that's not a very good treatment. I mean, it's good for the 30% that get all the way better, but it's not great for the other 70% that are still depressed. And so we need better solutions.
yeah, I was going to say that 70% seems like a success, like 30% is a success rate that feels a little bit low, uh, apparently. It
It
feels,
does feel a little bit low.
yeah.
And the reality is, you brought up placebo. The reality is some of the people who get a placebo also get better. And so the difference between the antidepressant and the placebo is actually much smaller than even that. Um, and and we think that it's probably just that depression can sometimes go away on its own, even without an antidepressant or any intervention. Sometimes it just goes away. And and so we have to take that into account, even among those 30% that do get a remission.
Are there side effects to these medications that people might not be fully aware of? Either people that are taking them already or people that are considering going into them? Uh, because we know they have side effects, of course, like any medication. But are there side effects that people might not know about fully?
You know, one of the more worrisome things. So psychiatric medications definitely have side effects, and they're wide-ranging side effects depending on what medicine and what class of medicine we're talking about. So some common side effects to psychiatric medications include things like weight gain. Um, some of them can actually make your glucose levels go higher, and that appears to be related to developing type 2 diabetes or insulin resistance. Some of them can actually make cholesterol levels and blood pressure worse so that people are at higher risk for cardiovascular disease. And but some of them work beautifully for people. There are people, I'm not anti-medication at all. There are definitely people who take psychiatric medications and they work wonderfully for them and people feel better. And some people will say this medication saved my life even, and they don't have side effects. So I'm not here to stand in the way of that. But when people are trying medication after medication and not getting better, yet they are developing all of these side effects. They're gaining more weight, they're developing diabetes, they're increasing their risk for cardiovascular disease. That obviously is not a good path. And I think we in the mental health field have new options now based on this theory. And instead of trying more and more medicines, we might instead think about changes in diet. We might think about exercise. We might think about de-prescribing medication, helping people very slowly and safely taper off of medicine to see if we can help people heal and recover.
How did you come to the finding that the keto diet could be an alternative treatment for these conditions? How do you get there? I I would assume it wasn't like an epiphany that you had one day. It's probably a longer story than that.
It is a longer story than that. So, it really started with my own personal story, actually. I uh I don't need to go into too much detail, but I'm happy to if you want to, if
No,
you
of
want to
course.
spend time doing that.
Please
But
go as
so
much in detail as you want. Or
when I was a kid, I had a mental illness, and it started with OCD.
Mm,
Um, it was never diagnosed or treated. Nobody knew what it was, but I was just different, and I knew I was different, but I didn't know why or what what was causing it. Um, when I was about 12, some really horrible things happened in my family. My mother ended up having a nervous breakdown.
mm,
She actually developed a psychotic disorder. She and I went to live with her for a while, and she and I ended up homeless together. Um, and and then subsequently, I had all sorts of mental health challenges. I had very horrible depression and suicidality and all sorts of things. And by the time I was in my 20s, I still had lingering low grade depression, anxiety, OCD, but I also developed metabolic syndrome. So I had high blood pressure, bad cholesterol, high triglycerides, um, and pre-diabetes. And I was relatively thin. I was on a low-fat diet and I was exercising regularly. And year after year, my doctor kept telling me I needed to do something about it, and everything was getting worse. And at some point, he told me that I had to go on medicine for these conditions. And I took it upon myself to change my diet to a low carbohydrate ketogenic diet. And I did it in a last ditch effort. I really actually didn't think it would work. But I did it before I decided to go on medicine because I really did not want to have to go on medicine when I'm in my 20s for all of those things. And within 3 months, my metabolic syndrome was actually gone. Everything got better. My cholesterol got better. My blood pressure was normal. I no longer had prediabetes. But the thing that I noticed is that my mental health dramatically improved. I it I had better mood, concentration, energy, and sleep. And I had never felt that good in my entire life. I didn't, I actually didn't know what that was. And so that was over, 20, probably over 20, 25 years ago now. And so I noticed that and I knew that it worked for me, but I didn't really make much of it. I just thought that was a curious thing. And then I started recommending the diet to friends and family who wanted to lose weight. And they too started noticing improvement in their mood and energy and concentration. And then within a few years, I started using it in patients with treatment resistant mental illness. So, patients who had treatment resistant depression, anxiety, personality disorders, and not all of them got better. Not a lot of people didn't want to do a diet, and that was fine. I wasn't forcing anybody to do anything they didn't want to do, but I was offering it to patients who had tried dozens of medicines. They had been in psychotherapy. Some of them had already had electroconvulsive therapy or ECT, and nothing was working for them. So I figured, well, what do we have to lose? Like they've tried everything. Let's see if a change in diet might help them too. And shockingly, it did. For some of them, it made a dramatic difference in their moods and energy. And, so at that point, I was largely silent about all of this because the ketogenic diet, still to this day, is highly controversial. A lot of people think that it's a very dangerous diet. They don't like it. And I went along that way until 2016, when one of my patients with schizoaffective disorder, which is a cross between schizophrenia and bipolar disorder, he asked for my help to lose weight. And so, for a variety of reasons, we decided to try the ketogenic diet. Now, at this point, this man has schizophrenia, basically. I have no preconceived notion that it's going to do anything for his schizophrenia. Like, I was just using it to help people feel less depressed. I wasn't using it for schizophrenia. That's a serious, lifelong, chronic, disabling disorder. And within about 2 weeks, not only did this man start losing weight, but I began to notice a really powerful antidepressant effect in him. And I thought, that's really curious that he's coming to life. He's got more energy, he's positive, he's making better eye contact. Um, and I had never really seen him like that. But he still had hallucinations and delusions every day. The shocking thing to me was about 2 months later, he actually spontaneously started telling me that his long-standing hallucinations were going away, that his paranoid delusions were going away. This man went on to lose 160 pounds and has kept it off to this day. And he was able to do things that he hasn't been able to do since the time of his diagnosis. He was able to go out in public and not be paranoid. He was able to complete a school program. He was able to perform improv in front of a live audience. And those things would have been impossible for him prior to the diet. And that sent me on a path to understand how on earth did a diet just help somebody with schizophrenia.
That's a very moving story, and your own story is very interesting. I have one follow-up question. I don't want to get off topic, but I do have a follow-up question. Why did you try the low-carb diet? Somebody told you about that it could help you, or did you read it somewhere? Like, why did you go into a low-carb diet in the first place?
So I had been on a low fat diet for years. And at that point, that was what was recommended, was a low fat diet. And it didn't matter. Nothing else mattered. And so I was eating a lot of processed foods, um, but they were all low fat. So that was all that mattered, supposedly. And everything was getting worse. Um, and at that point in time, the Atkins diet was very popular. And I was actually really skeptical about the Atkins diet because I had learned in medical school, don't do that diet. That's a really dangerous diet. And yeah, it's nonsense and you'll die of a heart attack. Don't do it. And but nothing was working for me. I was doing everything right. I was on a very low fat diet. I was exercising regularly, and my blood pressure was just getting worse and worse. And I had heard from several friends and family members that the Atkins diet actually helped them reduce their cholesterol levels. It helped them get rid of diabetes. It helped them with all sorts of things like that. And it helped them lose weight pretty easily. And so in a last ditch effort, I decided to give it a try. And that's why I tried it.
Hmm. So coming back to the keto diet, then for someone who is hearing you say all this with your credentials and the whole story that you just shared, and it's maybe taking antidepressants now or not, but feels maybe episodes of anxiety. And but let's take the case that someone that is actually in antidepressants is taking medication and wants to try the ketogenic diet. How should he or she go about that?
So first and foremost, I want to say, please do not change psychiatric medications on your own. If you are taking medications and you are thinking about adjusting your medicines, changing the dose, or trying to go off of them, please work with your healthcare provider because it can be very dangerous to stop medicines on your own. For people who are already taking psychiatric medication, I actually would want them to work with their healthcare professional. I would want them to talk to their doctor or their psychotherapist, whoever they're working with for their mental health conditions. I would want them to work with those people and let them know that they might want to try a ketogenic diet to see if it might be helpful. Um, because there are some risks, and medications may need to be adjusted. And again, I want people to do that in a safe way.
Let's get into the nitty gritty then of the diet and how to go about this. How deep in ketosis do we or does someone need to be in order for it to actually have an effect in the direction that we're talking about? Because getting to ketosis, um, especially in deep ketosis, nutritionally, is not easy. Like I know in my own experience, I know it's just N of one, but in my own experience, getting to deep ketosis nutritionally is hard. It's harder than what people think. So I guess my question is, how deep into ketosis does someone need to get in order to get these benefits?
So one thing that I'll say is that everybody's different. And I think you're right. It can be very difficult for some people to get into ketosis. Looking at you, I don't know you, but I'm going to guess that you are really lean and athletic. And therefore, you actually have a much harder time getting into deep ketosis
Mm.
than somebody who is really overweight or obese. Somebody who is overweight or obese, it's actually kind of easy for them to get into deep ketosis. And the reason is because they have so much fat on their body already. And so for them, really all they need to do is restrict carbohydrates usually. If they eat less than 20 grams of carbohydrates a day, they will probably be in a high level of ketosis. For people who are thin and athletic, the diet gets much more complex. They have to maybe limit the amount of protein that they're eating. They have to increase the amount of fat that they're eating, and it can get much more challenging and difficult. The good news is that for people with mild to moderate mental health conditions, so people with mild anxiety or depression or even post-traumatic stress disorder, a lot of them don't need to be in a deep level of therapeutic ketosis in order to get a benefit. Many of them don't even need to be in ketosis to get a benefit. They might benefit by simply cleaning up their diet, getting rid of sugar and junk food. If they cut back on sugar and junk food, even like 4 or 5 days a week, so even if they have 1 or 2 cheat days where they allow themselves to eat whatever they want, many of them, simply by reducing the amount of junk food and sugar in their diet, will get a dramatic benefit in their mood, energy, concentration, and sleep. But for people who have moderate to more serious mental health conditions like chronic depression or severe PTSD or bipolar disorder or schizophrenia, they often do need a higher level of ketosis. And and we have some research already in clinical trials of bipolar disorder, for instance, that strongly suggests the higher the level of ketosis, the greater the therapeutic benefit. So it reduced their depression more, it reduced anxiety more, the greater the ketosis. And so those people, again, I would want them to work with a healthcare professional because they have a serious mental health condition and they shouldn't have to do this on their own. They should be able to get help. Um, but again, it will depend on that person because if that person is obese, it will actually be pretty easy for them to get into ketosis. If they can reduce their carbohydrates to less than 20 grams a day, they will likely be at a high level of ketosis. If it's somebody who is thinner and more athletic like you, it's going to be more challenging.
Um, I actually had a note here to ask you about how effective the low carb diet would be, but you already responded to that because my question was whether this was a binary situation in which it's either or if it's like a scale, and it is a scale. You just clear that out for me.
Absolutely.
Yeah.
Absolutely. And I think it's just really important to point that out to people
Hmm.
that if they try one change in their diet, let's say they cut back on junk food, if that doesn't work for you, please don't give up. Please don't think that, oh, no diet's going to work for me or no change in what I eat is going to work for me, because there are many options. There are many options worth trying. And again, if people are working with a healthcare professional, you can actually get really sophisticated and they could be measuring your glucose levels with you. You might be looking at insulin levels. You might be looking at the level of inflammation in your blood. Um, and all of those can play a role in your brain health. And that means all of those can play a role in your mental health. And so figuring out what works for you is really the key. And obviously, you want the easiest diet that you can do, or the easiest changes, or the least amount of changes to your diet necessary in order to get the benefits. And so there are lots of opportunities and lots of options.
What about fasting? I wasn't planning on asking you about fasting, but I think it relates to all this in a way, right? So obviously it's not a strategy for the long term because you can't fast forever. But do you use, or the professionals you work with, do they use fasting like to kick off the process maybe, and then that would lead into an improvement that then could be follow up by a diet strategy? Like, so is fasting an option?
So fasting is definitely an option for some people, but not for everyone. The people that I would not recommend fasting for are people who are underweight. So people with eating disorders, people who have had severe depression and lost a lot of weight. And I would not recommend fasting for children or adolescents because they are growing. They need to eat regularly in order to grow, and their bodies just need that nutrition. For people who are overweight or obese, fasting is definitely an option. And because they have excess calories, excess fat on their body, and we want to tap into that. And fasting is the easiest way to do that. And, I didn't say this already, but it's worth saying. So, one, the ketogenic diet actually is a fasting mimicking diet. And that is actually why it was developed, is because it mimics the fasting state. The other thing that I didn't mention, in case some of your listeners are confused about why would a ketogenic diet be good for your brain? A lot of people know keto as a fad diet or a dangerous weight loss diet, but in fact, it is actually a 100-year-old treatment for epilepsy, for seizures. And this diet, the ketogenic diet, can stop seizures even when medications fail to stop seizures. So in children, adolescents, and adults who are having seizures despite taking medicine, the ketogenic diet can sometimes stop their seizures. The reason that's so important to me as a psychiatrist is because we use epilepsy treatments all the time in psychiatry. Many of the pills that we prescribe to people with mental health conditions were actually first developed for epilepsy. And so, for any of your listeners who are confused about why are we talking about diet for these serious brain conditions, these serious mental health conditions, it's actually not that far-fetched at all.
Speaking of people thinking that the ketogenic diet is a fad diet and is like dangerous, one of the main concerns that people have about the ketogenic diet is that for some people, it can higher their LDL cholesterol. And for some people, that is a concern. Is this something that you worry about? Should they be worried about this? Is a concern? What's your take on this?
So I am a strong proponent of measuring your cholesterol levels, your blood pressure, your glucose levels before starting a ketogenic diet so that you know where your levels are at. What is your LDL cholesterol? What are your triglycerides and your HDL cholesterol and your glucose and your blood pressure? Because all of those put you at risk for heart attacks and strokes and type 2 diabetes. Um, and and so it's good to know where they're at before you start. When people go on the ketogenic diet, people who are overweight and obese actually across the board tend to have improvement in almost all of the metabolic biomarkers or all of the risk factors for heart attacks, including LDL cholesterol. Their LDL cholesterol often goes down. Their diabetes can get dramatically better. Their triglycerides and blood pressure and everything can get better. And so when we've looked at, there have been dozens of studies looking at the ketogenic diet for weight loss and for type 2 diabetes. And overall, those studies do show that the risk factors for heart attacks actually improve when people are on a ketogenic diet. Now, there is one exception, and it's the one you brought up, LDL cholesterol, in particular in people who are already thin. So in people who are thin, so you are a good example of somebody who's thin and athletic. And if you did a ketogenic diet and got into deep ketosis, you fit the category of the person whose LDL cholesterol would actually go up. And sometimes it can go up to very high levels. And right now, um, the cardiology field is terribly worried about that and thinks that that is very dangerous and very risky. But there are some studies by a leading cardiologist here in the United States at UCLA who's studying these people who are thin and on a ketogenic diet and have very, very high LDL cholesterol. He's actually studying whether they are developing um, atherosclerosis, which is kind of hardening of the arteries or clogging of your arteries. And they just completed a 1 year study recently in which he followed these people for 1 year or more. And these people have ridiculously high LDL cholesterol levels. And after 1 year, they showed no signs of developing atherosclerosis. They didn't see anything. And he anticipated, based on how high their LDL cholesterol was, that he should have seen their arteries getting clogged, and they weren't. And so there's research underway now to try to understand that. But right now it's early. We don't know. And so I would say if somebody is on a ketogenic diet and has very high LDL cholesterol, the safest thing I can say is to work with your healthcare professional to figure out the best strategy for you.
This is quite paradigm shift. And what you are doing is, in a way, well, this is a new way to see at things that how we've seen it over the past 30 years. So I could imagine that you must be having some sort of pushback against it. It's only normal that humans, whenever there's a change in the way we go about things, there is always resistance to change, right? So, for example, when it was first linked, the relationship between what we eat and our cardiovascular diseases, like people thought that was crazy. Like, what do you mean that what I eat affects my heart? And now, of course, that's a common practice to focus on nutrition when you have a cardiovascular problem. So are you suffering some sort of pushback, resistance to the implementation of this therapeutical use of the ketogenic diet for depression?
When people just hear that Chris Palmer is using the ketogenic diet to treat mental illness, yes, people are highly skeptical. And I welcome that skepticism. That's fine. They should be skeptical if that's all that they hear. But for people who have listened to more nuanced conversations like you and I are having right now, for people who read the book that I've written, Brain Energy, or for people who read the scientific publications that I've published in peer-reviewed academic journals, they actually increasingly are realizing that this may in fact be a significant advance. And so we have somewhere between 12 to 15 clinical trials of the ketogenic diet for mental illness underway around the world right now. I happen to work at McLean Hospital and Harvard Medical School, and we are currently ranked number one in the United States for psychiatry. And I don't say that to brag, but I say it because we are starting research trials of the ketogenic diet for serious mental illness. And we are starting an entirely new program on this intersection between metabolism and mental health. And just 2 days ago, I had the privilege of participating in an academic webinar sponsored by the European College of Neuropsychopharmacology with leading scientists and psychiatrists, all focused on this topic of metabolism and mitochondria and mental health. And so I think that there is extraordinary enthusiasm in the mental health field among researchers in particular, because the researchers get it. They understand the science. It's not simple science. I'm just going to say that. It's not simple. But the researchers get it. And they know that this could change the mental health field. Finally, we might have new treatment options for the millions of people who are not getting better with our current treatments. And they deserve that. They deserve better treatments and they deserve better lives. And I think we as a field are hopeful that it's going to happen soon.
It's so promising and so exciting, everything you're doing and how things are changing. Humans are humans. And as humans, we always want to find shortcuts and more productive ways to do things. So, probably some smart people out there hearing this conversation will say, like, well, if the ketogenic diet is going to help me with my mood elevation strategies or even helping me with my depression or anxiety, I'm just going to follow a normal diet and go on Amazon and get some exogenous ketones, get some ketone esters or ketone salts, and problem solved. Done. Would that work or not?
Unfortunately, it probably will not work.
It won't.
I wish it would. I really do. I like simple solutions too. And I would love to be able to just have people drink ketones instead of changing their diet. That would be so much easier for all of us, me included. But unfortunately, it's not that simple. When, but with that said, exogenous ketones might play a role. So there are some researchers now studying their use for alcoholism, of all things, they might actually be really useful to people who are alcoholic and trying to stop drinking. They might play a role for some people to kind of augment a low carbohydrate or a ketogenic diet. So if somebody can't get their ketones up high enough, they might be able to use exogenous ketones in order to accomplish that. But if people are largely eating a junk food diet, if you're eating donuts and cookies and ice cream, and then just drinking a bottle of ketones, that's not going to do much of anything at all. And so because part of it is that if you're eating all of that junk food, you are still going to be on your way to insulin resistance or type 2 diabetes. And drinking a bottle of ketones every day is not going to solve that problem. But lowering your glucose levels and your insulin levels can help you solve that problem. And that has a direct effect on your brain. And that's the thing, is that what we eat does impact our brain. It would be like, could you prevent a heart attack by drinking a bottle of ketones every day? Everybody knows, no, you can't do that. Um, could you still smoke cigarettes every day and just drink ketone? No, you can't do that. Like, you still have to follow a good, sensible, healthy lifestyle in order to get the benefits.
Mm. I was just trying to anticipate a course of action that many people will follow by connecting the dots,
Absolutely.
and who knows. What subset of people with mental health issues, Chris, would benefit the most from going into a ketogenic diet? I mean, because this is a wide range of different problems that people might have. So, which are the group of people that are statistically or potentially more likely to benefit from this?
The real answer is we don't have enough information yet for me to be able to answer that in a scientific way. Um, I can tell you that there are researchers studying this diet for Alzheimer's disease. We've got trials for depression, for post-traumatic stress disorder, for alcoholism. But most of the studies, most of the research is actually focused on two mental health conditions, and those are bipolar disorder and schizophrenia. And I'm not convinced that that's because the ketogenic diet will be most effective for those people compared to people with depression or alcoholism. But I think it's because our current treatments are just not very good for schizophrenia and bipolar disorder. And people with those diagnoses are often disabled by their illness. Their lives can be ruined by those illnesses. Even when they take their pills every day, their lives can be ruined. And the mental health field has been desperate to find better answers. And the reality is that the ketogenic diet appears to be a very powerful treatment for some people with bipolar disorder and schizophrenia. So I think the researchers are most just fascinated by that, and they desperately want better treatments for those people. Someday we may realize, though, that just going on a no junk food diet, simply getting rid of processed junk food, might be the optimal diet for people with depression and anxiety. And we might call that the Mediterranean diet. We might call it a paleo diet or whatever. There are lots of versions. And for people who are vegan or vegetarian, I didn't say this already, but you can actually do a vegan or vegetarian ketogenic diet. So you can eat only fruits and vegetables, but maybe people will go on a whole food plant-based diet, and that will work well for them. And the reality is I really welcome more research. I'm excited about getting more research so that we can answer those questions and so that we can give people better advice about here's what will work for you, or here are the diets that we think you should try.
You mentioned Alzheimer's disease. That's one of the um, diseases that people fear the most. People are very afraid of that. Um, so could the ketogenic diet be a good option also for these patients, or even for people that might have that running in the family and they're very afraid um, of developing it? So could it be useful to follow a ketogenic diet for those people too?
It might be. So we have some early clinical trials. There are small pilot trials, but one of them I think was about 26 patients maybe, and they had the patients follow a low-fat diet for 12 weeks and a ketogenic diet for 12 weeks, and everybody got both diets. And they did them in different orders. And when the patients, and these are patients who have Alzheimer's disease, when the patients were on the ketogenic diet, they actually had improvement in their activities of daily living and improvement in their quality of life. And those were both statistically significant. They also did have improvement in their cognition, their memory, but that did not reach, it wasn't big enough to reach statistical significance. So there are larger trials underway now of the ketogenic diet for Alzheimer's disease. But I will take a step back and think like, well, why would that even work? And we know that some of the biggest risk factors for Alzheimer's disease are actually having type 2 diabetes or being overweight in midlife, having obesity in midlife, or having higher risk for cardiovascular disease. That all of those things put people at increased risk for Alzheimer's disease. And we know from numerous randomized controlled trials the ketogenic diet can actually help people lose weight. It can help improve type 2 diabetes and lower insulin levels and lower glucose levels. And it can improve cardiovascular risk factors. So we have lots of evidence to call upon to understand that for some people, the ketogenic diet or even just a low carbohydrate diet may actually play a very powerful role in helping to prevent Alzheimer's disease.
Um, I think I'm going to go with the last question. I want to be respectful of your time. Uh, on the Huberman Lab podcast, you with Andrew, you at some point you were talking about how in the 70s and 80s there in the US, like people were already eating junk food in those decades. It was something that surprised me when I hear that, because I don't think that is the case here in Europe. I mean, for sure, not in Spain. Um, but then it got me thinking, well, if in the US people were already eating high amounts of junk food 50, 40 years ago, why is it that the obesity epidemic is skyrocketing only the last 20 years? Like, it doesn't add up. So is it a theory as for why that is happening then? If there is, I don't know.
Yeah, that is one of the most important questions of our generation,
Hmm.
is why. And many researchers are studying that question to try to understand. The reality is, when you ask some of the leading obesity experts, if you ask 5 different obesity experts, what exactly is causing obesity? What is causing the obesity epidemic? You won't get the same answer from those 5 people. There is widespread debate and disagreement about what causes obesity. And some researchers recently are coming out and saying that they believe obesity is primarily a brain disorder. It is a disorder of the parts of our brain that control metabolism and the parts of our brain that control whether we feel hungry or full. And that when those parts of our brain are malfunctioning or dysregulated, then we can end up eating more than we should, or storing more fat than we should, or not burning as much fat as we should be burning. So back to your question, I think the 1970s tells us that eating junk food immediately, right away, doesn't necessarily result in skyrocketing rates of obesity. And so that then gets into, what did our parents do and what did their parents do? And it turns out that if your mother was eating a lot of junk food and she maybe gained 10 pounds, she was 10 pounds overweight. If she was eating that junk food while she was pregnant with you, that puts you at higher risk for developing obesity from the time that you're born. You didn't do anything wrong. You didn't eat anything wrong. You came out of her womb with a higher risk for obesity simply because of what she was eating and because of her weight and her hormones and everything else. And then if that child then goes on to develop obesity and then has a child, that child is at very, very high risk for developing obesity. Now, some people think that that's genetic. And in fact, it's probably not primarily genetic. It's probably something called epigenetics. So it's the environment, it's the food that they were eating, the hormone responses to those foods that impact the fetus growing in the mother's womb. And then that programs that child to be at higher risk for developing obesity. And unfortunately, if that is what's happening, and many lines of scientific evidence suggest that is, in fact, what's happening, it means that the problem will only continue to get worse unless we get a better understanding of how to address it. And I do believe that we have enough science now to, again, it's complicated science. We start having to talk about these tiny things in our cells called mitochondria and all this other stuff. But I actually think that if we put that science together, we may actually be able to stem the tide of the obesity epidemic and the mental health epidemic that we are experiencing, because I don't think that they are unique. At the same time, I didn't say this overtly, but at the same time that we've got skyrocketing rates of obesity and diabetes in the world, we also have skyrocketing rates of mental illness.
I mean, I don't want to open that box of worms, but
Sorry.
it's no. What I mean, I didn't want to. I don't. Well, let me. Can we talk for 5-10 more minutes?
Absolutely.
So, I would assume then that you are suggesting that that's not correlation; it's causation.
So I am suggesting that there is a causation factor, but it's not in the way that people think about it. So I'm not saying that obesity causes mental illness. And I'm also not saying that mental illness causes obesity. What I'm saying is that there is something that happens in our cells before either of those. Metabolic dysfunction in our cells. That is what causes both obesity and mental illness. And it can come out in different ways in different people. So not everybody who has metabolic dysfunction will become obese, and not everybody who has metabolic dysfunction will develop a mental illness, but they are at higher risk of developing both. And some people, depending on your genetics and epigenetics and your environment and your childhood traumas and all of that, some people will go in the direction of developing a mental illness first, and other people will go in the direction of developing obesity first. But both groups are at higher risk of then subsequently developing the other. So we have a large population study that people with obesity are in fact at higher risk of developing a wide range of mental illnesses, not just depression from fat shaming. It's depression, anxiety, it's eating disorders, some substance use disorders, but even bipolar disorder and schizophrenia. They are at higher risk. Obese people are at higher risk of developing all of those things, and Alzheimer's disease when they get older. But people with mental illness are also at higher risk of developing obesity, even if they start out thin. So they could be thin and have a mental illness first. That will then put them at higher risk for developing obesity and Alzheimer's disease, unfortunately. So I do think that there are some common pathways that we can look at. And again, although it can get complicated, understanding these complicated pathways offers hope. It offers hope to help people recover, to help prevent these things from happening, to help improve our human health.
Well, I hope we can change the direction of the tide with work like yours, brain energy. Dr. Palmer, it's been a pleasure to have you on. I really enjoyed this conversation with you. I've learned a lot, even though the book is, as I said, is very thorough. I'm recommending, in Spanish, is Energía Cerebral to all of my friends. They are very excited that I was going to talk to you. And where people can find more about you, or other than your book, is there a place where people can find more about your work? Or
They can, so I have a website. I actually have two websites, brainenergy.com. And there you can actually see lots of podcasts and media interviews. Many of them are free. You can take a self-assessment to just get a sense for your metabolic and mental health. And all those resources are free. You can sign up for our newsletter there. Or I have another website, chrispalmermd.com. And you can learn more about my research work and my academic work there.
great, we'll put it in the show notes and in the description in the YouTube version of this interview. Thanks again for everything you're doing, first of all, even before spending an hour with me. But also especially thank you for all your work. Everything you're doing, I think, is very necessary. And I think we can stop the snowball effect of this whole thing that we were closing with.
I hope we can too. So thank you for having me on, and thank you for all of the work you're doing to promote people's health and help them live better, healthier lives.
We try. Thank you very much, Chris.
All right, thanks.